what were your impressions of coming to this clinic, and what's going through your mind right now? What you learned?
Well, wonderful program that's being done here. We met with a doctor, with Doctors Without Borders, who is one of the physicians here, some of the nurses. Enormous dedication, a great spirit of hopefulness. The women here who are HIV infected and pregnant. Almost all of their children are testing negative. This has been one of the success stories, is reducing the incidence of infection among infants here in South Africa. And that's a great positive, and it's a testimony to the good work that's being done here.
How do they do that?
Well, the infants are amenable to treatment if they are caught early enough. And so the key is making sure that the mothers are tested and that they're carried through that process, and so that the children get immediate treatment. And essentially it's sort of a wonder of the human body in infants that they can essentially cure themselves of the disease or be cured of the disease. Now, having said all that, I think there are a couple of things that are distressing. One is the fact that there is still an enormous amount of denial around AIDS in this community, and some of it has to do with some denial on the part of the government. And I think that's something that's going to have to be addressed. You've got enormous infection rates. There's not enough public education. Among men in particular, there is a need for a fundamental change in behavior. And that behavioral change is not going to happen until leadership, male leadership in particular, both traditional and political, stand up and say, that we need to institute safe sex practices.